Hello, all C3RF members and patriotic Canadians across the nation. It's a real pleasure to have you with us today for another session of In Hot. Remember, In Hot is a fighter pilot term that denotes the pilot has just received clearance to go in hot, to roll in on target with weapons loaded and armed. And today we're going to roll in on the growing phenomena that sees Canadian doctors from across Canada getting together to issue warnings and ringing alarm bells. And today we have a very able wingman with us in the form of Dr. Stephen Malthouse. Dr. Malthouse has been a family practitioner of long standing in Denman, British Columbia. And he kind of got himself in a little bit of trouble there with a letter to Dr. Bonnie Henry. And I'm going to share the screen here. First off, just to show that Dr. Malthouse was held in high regard in his Denman practice. He's like a 4.5 out of 5-star doctor. And then he got involved with the pandemic measures, and he wrote an open letter to Dr. Bonnie Henry, which is right here. This is from October 2020, so you can see this is very early on in the pandemic. And he basically said he was writing this letter in the hope that Bonnie Henry could clarify the basis of her decision-making that's led the provincial government, health ministry, regional health officers, hospitals, medical staff, and everyday citizens to follow pandemic policies that do not appear based on high-quality scientific research and, in fact, appear to be doing everyone a great deal of harm. Now, from that point on, Dr. or Stephen, I take it that you got yourself in a bit of trouble. What happened subsequent to that letter? Was there an immediate response? Were you happy with the response? What happened?
Well, hi, Russ. Thanks for having me on the program. And I thought in hot meant being in hot water, because
no, you're not in hot water at all.
It's nice to have it straightened out for me. But I never received a response. I sent that to Dr. Bonnie Henry, but also to all the public health officers in the province of British Columbia. And I didn't hear a peep from anybody. And, we had sent things previously. The Canadian Integrative Medicine Association, or CIMA, we put together something in April, May, and it was about how seniors in long-term care homes could benefit from additional vitamin D. And we gave evidence for that. Also, there are a lot of other vitamin and nutritional deficiencies that people had. And so that would have been a very simple thing to do. But again, we didn't hear anything back. And then, a study came out of Malaysia showing that if people had adequate vitamin D levels in their blood, so that would require a blood test, that they had a 0 mortality rate from COVID. Oh. Simple as that, right? So we could have stopped this whole thing back in April of 2020. The evidence was there for benefits, and it would be so inexpensive to distribute vitamin D in the long-term care homes, and could have saved a lot of lives. But we didn't.
Well, these sound like very, very commonsensical suggestions. I can't see why they wouldn't want to even entertain them. But from what I see from what happened following this was, not only did you not receive any responses, but your information was actually labeled as misinformation, disinformation. Your whole professional pedigree was called into question by people who were supposed to be looking out for the public health. How long? When did that start to happen? Was that an immediate thing after your letter to Bonnie Henry, or was that just an ongoing thing?
Well, it kind of started there. In fact, it started in June of 2020 when I had something on. I live on Denman Island in British Columbia, and I just called together the community. I put out an invitation to meet, and we did 2 of these meetings where we discuss all the things which seem either absurd or contradictory. For example, you could have 2 people meet in Quebec, and you could have 6 in Alberta, and you could have 14 in BC, that type of thing. And people were going like, well, I don't get it. I'm driving across the country. And all these different regulations, they don't make sense. And what's going down here? I mean, do we really have the number of deaths that we keep hearing about, and mislabeling of things? The PCR test, is it really reliable for making a diagnosis? So there are a lot of questions. And so when I called our community together, I invited them to come. I immediately got calls from my College of Physicians and Surgeons saying we had 2 telephone complaints, and nothing, officially written at that stage, but they started to say, hey, now you got to say this thing, that this is not the official stand. You've got to make these sort of statements before you even discuss stuff. And then they were onto my case even then. So I had to defend that. Again, misinformation has been, bandied about, but no one ever actually ever identifies what that misinformation is. And I think I got a stack of complaints at the college accusing me of spreading misinformation and killing people. But no one actually tells me what that misinformation is. And then the college sends those onward, which is ridiculous. They're essentially attempting to, I believe, snow myself and other doctors under with legal costs to defend yourself. And
yes, mm-hmm.
Yeah, that's the way it seems to be done.
I've seen this the same thing happen in Ontario with the College of Physicians and Surgeons of Ontario.
Yeah,
going to their actually writing to all their doctors that they're responsible for overseeing, and telling them that they've got to fall in line, and you can't go out there and say that even things like vitamin E are helpful. You have to toe that line, and that line is all about lockdowns, distancing, mass vaccination programs. And if you don't toe that line, then you're in trouble. I'm just going to cut away here again to show something else, Stephen. And this is your College of Physicians and Surgeons of British Columbia. They have you up on the site, and they have you suspended. So
yes, yeah,
they took suspended your license, and you're not able to practice.
That's right. In fact, if I practice medicine, they're knocking at my door right away. There was I was suspended. I won't go into this very much, but the main thing was writing exemptions for people so they didn't have to have the shot, because we never had informed consent. It was impossible because we don't even know the ingredients of these shots. And what we're seeing now under the microscope and with spectrometry and other methods is that these shots are full of stuff that's not been declared, and is certainly not on the label. There's a lot of manufacturing variability in the amount of mRNA that's supposed to be in these shots, from 0 to 50%. There was actually one manufacturing facility in the United States where they closed it. Essentially, they said, well, you're not providing any more for the US, but hey, we'll send your stuff up to Canada, no problem. And Health Canada just let it ride. And so there's a lot of junk in here, and including what we're seeing now, we think of as nanotechnology, which is being identified by more and more independent researchers around the world, working in groups of 10 or more researchers. So it's bad news. And if you just take the vaccine itself, which is not a vaccine, as you know, because it doesn't prevent infection. No, but it's a genetic therapy, and we're even seeing that it does go into your own code. It does get into the nucleus of your cells, and it will affect your DNA. This has been shown on human liver cells in vitro. So yes, it does affect you at a pretty deep level.
I have seen some of the studies. I try to keep abreast of the studies as they come out, and I'm just seeing more and more and more, and it just amazes me that there's not more information forthcoming. When we talk about misinformation, maybe I think we also have to deal with omissions of information, and it seems to me that there's an awful lot of omissions, or not being told, as you say. I mean, if you see an advertisement for a drug on TV, they list all the side effects you can expect, from Blackfoot to long tongue. It's all there, and they have to be upfront. And with these gene therapies, vaccines, whatever you want to call them, or people are not seeming to get this informed consent, the information they need to make informed consent. So I'm just going to cut away to another screen here, Stephen, to show that here's CBC. They're talking about you, BC doctor accused of spreading misinformation. you know, and then I'm going to go to another screen here. But now we see, here we have Denmark. This is very recent. Actually, a few weeks ago, they banned vaccines for the under 18. Now they're not just stopping or saying, you know, recommending against under 50s not getting vaccinated. They are banning. They are actually banning vaccines for the under 50. As they say, a minimal benefit can be accrued by this age group if they're healthy. But the unknown or the unsaid thing here is several studies have already shown the risk of serious side effects from COVID-19 vaccines is higher than their benefits for younger people. This is, of course, the most probable reason why Denmark has banned them. Now, Denmark doesn't say they've actually banned them, because they have an official document that they've come up with from the Danish Health Authority saying that they're not going to give these vaccines to the under 50 anymore. But basically what they're saying is even if you ask for them, they will not give them. They have basically, and in effect, banned these vaccines for the under 50. So we have this accumulation of data, of studies that's coming out, and yet we still see Canada, as recently as a few weeks ago, recommend these vaccines and boosters for the 5 to 11-year-olds. And now they're going for the 6 months to 5-year-olds.
Well, actually, they've already okayed the 6 months in Canada. Okay. With, first of all, the Moderna, and they've just in the last week or so okayed it for Pfizer shots. Now we know that age group. I mean, can you imagine giving your 6-month-old a shot against COVID? They had statistically a 0 mortality rate. In regard to trying to find these kids in ICU, it was impossible. You couldn't find them there. So you didn't have sick kids. And when they did the studies, I mean, they were really ridiculous. They used such a thing called immune bridging. And that's where they look at the antibody formation and they say, okay, you've got antibodies, that means it works. And they compare those to an older age group, in fact, to say, hey, instead of saying, hey, it's better than the comparator or the placebo, they said, well, look, the older age group had similar and we allowed it for them. So that means it's good to go. I mean, It's really crazy, but you know, there is an agenda behind this, which is way beyond just health. And when we read those things about Denmark, it gives us a little sense of hope that some countries are going to change around. But I think what it is, it's a bit like they'll retract it in one place and they push it forward somewhere else, or they maintain it somewhere. It's really being done in a global scale. It is an agenda. You can tell that by how on the same date in 10 different countries, the same policy is rolled out. Yeah. So we're not going to sit back on our laurels because Denmark says they're not going to give it to under 50s. Because in a few days' time, they can say, okay, we restarted it in under 50s. That could happen very easily. And we've seen lots of promises being broken.
Oh boy! So I've also seen another doctor out in British Columbia. I think you might, Dr. Charles Hoff.
Oh, Charles, yes.
Charles,
yeah.
Charles Hoff. He's another doctor that's come out with his own practice, and I believe he's similarly suspended and can't practice anymore.
Well, he's not actually.
No.
He's not suspended. No, he did have his ability to work in the emergency department removed, so he can't work in emergency anymore, and that was about 50% of his practice. But his family practice, which since his office was burned down in that fire in Lytton last year, Lytton, BC, he's now working from home and also on the local Indigenous band territory. So. He's still practicing. He hasn't, but I think he's got the record for complaints against him at the college right now, and he's fighting back. Charles is a fantastic. Yeah, absolutely. Well, you probably know that term. If you're getting flack, it means you're over the target.
That's right. It's true too.
That's what we feel. So whenever we get a hit piece done in the CBC or CTV or Global, which is not. Is fairly common for us these days, I guess. Well, relatively common. We have a term in medicine. It's not uncommon. I don't know what that means exactly, but it means something in the middle there. It's a sign that we're having some effect. That they think that we're significant enough to take up print space, and I think that's a good sign. Yeah, we like it because it gets the word out.
Dr. Hoff because of his personal experience with his practice. I know. He works with the Indigenous community there on the reserve, and he had multiple people who got the shot and had very bad adverse effects, very bad. And I just wondered if you had personal experience along those lines yourself with your practice before you were suspended.
Well, I did treat people with COVID, but I haven't actually been treating vax injuries because, you know, I've kind of been out of the workforce to a certain extent because I took a sabbatical in beginning of 2020, intending to do actually meditation retreat, and it never quite. It sort of started up, got ready, got prepared, and then along came COVID. So I pretty much spent the last 2.5 years studying the COVID issue and you know, trying to keep up with the research. Because as you know, in the early days, it was like, you know, if you had one good paper per week, you know, or one video that came out per week, that was about it, and it was easy to keep up. But nowadays, every day, you know, you're sitting in front of a computer doing Zoom calls, gathering information to keep up to date. So yeah, so I can't really talk too much about treating the injuries, but I am connected with a lot of doctors around the world who are treating these injuries. Okay. And we're now trying to piece together algorithms. If people are looking for where to go, if they have an injury or someone who's injured, the FLCCC, which is the Frontline Critical Care Consortium, yep. That's a group of intensive care doctors, but they're actually branching out even into the naturopathic type medicines, which is great. And they've pretty much got the best place to go on their website to find out how to treat these things. But, you know, Charles had something what I thought was really interesting, and that when he had people who had the shots, but did not have any symptoms of the shot, they thought the shots had worked just fine for them. Yeah. He did these D-dimer tests on them, which is evidence of some kind of clotting somewhere. Now, none of them had pulmonary emboli, and none of them had clots in their brain like strokes. So it means that they had microscopic clotting somewhere. But where, no one knew because they didn't have symptoms. But 53% did. Now, that means that if you've had the shot, but you don't have symptoms, you could have something happening to you that you're just unaware of, and that you need to treat yourself like you're having an adverse event, because more than half of the people are having one and they don't even know it.
Well, that's incredible. That's like 53%, the majority of people he treated or looked at.
It's shocking. So don't wait till you have your stroke. Treat yourself like you've had you've already been in, you're on your way to an injury. And in Thailand, they did a study recently where they showed that, where they looked at kids who were 13 to 18, I believe the age group was, and 1 in 43 had myocarditis, perimyocarditis, which means either the sac around the heart or the heart itself, the muscle. When that is injured, it never recovers. So you've got a scar in your heart, which can lead to congestive heart failure as you get older. You know, sudden death is a possibility. We're seeing among, you know, all the, you know, more than 1,000 athletes have had cardiac drop events, you know, and more than about 800, I think, of those died. So they can't resuscitate these people. No. Yeah, so I think that's come from Charles, that's really important data for people to know, because it means assume that you've got an injury until proven otherwise.
Yes, to be on the safe side, the precautionary principle. I'm also seeing that might explain why we see so many professional athletes dropping on the field of contest. They're working hard. They stress themselves, and all of a sudden they keel over. And the numbers are just incredible. I think I saw a report out the other day where over the course of some 38 years there were such and such a number of athletes that actually experienced that type of impact, or that kind of adverse impact on the field, or died. And now, over the course of the last 6 or 8 months, we're basically at the same number as we accrued over 38 years between 1966 and 2004, I think. But I'm also seeing, and maybe you can comment on this, your fellow doctors across the country. We're seeing, 5 die here. Mississauga, there was 5 in a week, and then there was 1 in Hamilton, and now I think we're up to 32 doctors.
33 actually. We just had one the other day. Dr. William Mackus in Edmonton, he actually dug around to find all these doctors that have died because they're not being reported. It takes quite a bit of work to uncover the evidence. And people say, hey, well, doctors die all the time. There's nothing that they're just like everybody else. But in fact, Steve Kirsch did some analysis of in terms of the timeline, like how they're dying within 2 weeks of the rollout of the booster shot. What does that mean? And he found it was like a 12 times increase mortality among doctors compared to previous years. So it's not good, and they're dying in their sleep. They're dying, with exercise. Some people argue, well, they're dying from cancers, and of course that's a long-term thing, but these are people who are dying from aggressive cancers that are coming on, and they're dying within 11, 12 months type of thing, which is usually unheard of. They should have such aggressive cancers in this age group. And some of them are there's one, I think, case that's a very peculiar type of cancer, like a rare spinal cancer. So all of it points to the fact that, the doctors, they took it because they were mandated to take it.
Yes.
They may have thought that was a good idea because a lot of doctors aren't doing their homework, and they're dying. They're dying at a rate which is extraordinary. But where do you see this in the mainstream media?
No, you don't see it at all. No. You have to, like you say, you have to really dig for it. There are reports coming out of the UK. These are official reports out of the UK. Has an Office of National Statistics, and they came out with some research within the past week or two, which is showing that people who get the jab, I believe it's something like 1 in 200 and something die within the first 60 days of getting the jab.
Whoa.
And they look at it 30 days, 60 days, and 90 days. I just remember the 1 in 263 number over a 60-day period. And you got to ask yourself what's going on, and shouldn't our public health authorities, who are charged with looking after our well-being, they should be right on top of this. They should be digging like badgers into this data. If anything, to assuage us, to tell us, oh, that's misinformation, and here is why it's misinformation. They're not even talking about it.
No, absolutely not. And the VAERS reports in the States, even though it captures like 0.8% of vaccine injuries, it's meant really just to put up red flags. It's not meant to be a highly calibrated machine to tell the exact numbers.
Yeah.
And but the CDC is not reviewing it properly, and so they don't seem to care. It's just because the agenda is different for these organizations than we would expect. Mm-hmm. It's not actually anything to do with protecting the public, and it's really nothing to do with health. It's there's a deeper plan here that's afoot, and we're just seeing the tip of the iceberg, this aspect of it. Because meanwhile, they're shifting things to a digital identity, which is going to be essentially the closing of the jail door on you. The cell door will be closed if you go with digital identity, and because what that leads to then digital currency, centralized banking, and then you're never be free, at least for 100 years maybe, because they control your food.
Stephen, I have the uneasy feeling that this federal vaccine passport or the ArriveCan application is kind of the camel's nose under the tent type thing, because it seems to be hooked. They're very reticent to let it go. Like nobody likes this ArriveCan. It's killing our air industry. It's killing our border crossing operational capability. But the feds they refuse to let it go. And when you look at the ArriveCan and you look at things like digital identity, you look at the known identity travelers program, in which Air Canada is partnered with Netherlands, which is partnered with the World Economic Forum, to come up with digital ID for us. And this is all seems to be hooked back into ArriveCan, and it all seems. And then we have as you say, the digital currencies are in there as well. And the World Economic Forum is wrapped up with that initiative as well.
Yeah.
So I have a very, very uneasy feeling, and I think there needs to be lots of explanations of just what the heck is going on here, because we're not getting that information.
Well, people are seeing that people are starting to realize that that doesn't make sense anymore, and there's some more nefarious schemes afoot, and but they don't know quite how to figure it out. A lot of people will go as far as saying, "Well, I can see the masks don't work, but why would the government tell you to wear them then?" They've kind of got to that point, but they can't accept the fact that their government is out to kill them in Canada. I mean, that's kind of the bottom line. They're either out to kill you or to control you. And
That's a very, very hard thing to say, but I think it really speaks to the fact that there needs to be a lot more transparency on just what the
Oh,
heck is going
yeah.
on.
But there won't be because, that's, if you're going to do a takeover, that's what you do. You essentially, you censor everyone who's speaking out. You control the media, and you shut down the radio stations and probably control the aircraft, right? Like go for the airports,
Like they
right?
say, always go for the telecommunications center. Yeah, that's the first thing you do.
Absolutely.
Now,
And
I'm very glad to see that you're not alone. Maybe
no,
you used to be alone or almost on your own because you were one of the first to ring the alarm bell. But I see that other doctors have joined you. I think Charles Hoff is with you as well. And now you're setting up tours, cross Canada tours. Can you talk about your tours?
Sure. Well, we've got 2 tours coming up. It's surprising that people are hitting the road, not just doctors, but other people, to speak out and to talk to the communities at a level, because you can't do it through the television set. It's not possible. So we have to do it in person. And we actually did 3 tours, doctors on tour. It was called Educate Before You Vaccinate, where we tried to give parents the information they needed to make an informed decision as best as possible about the shots for kids from 5 years up. And so we went to about almost 30 different places and spoke to the communities. So we've got something else starting. It's called, the program is called Justice for the Vaccinated. Because there are a lot of that the emphasis is shifted now. People want to know, first of all, have I been injured? And what do I do about it if I have? And because again, where do you go to get the information on how to treat a vaccine injury, so-called vaccine injury? And because some of these are pretty awful, and we have neurological injuries, we have cardiovascular injuries or vascular injuries, and then we also have a cancer popping up, and there's also a question about genetics. Will this be transmitted to our children? I mean, we have kids who are having injuries from breastfeeding, right? Like the infants. And so there's a lot of questions out there. People don't know where to go. So we're going to try to get out there and tell them not just where to get this information, but how they can become active to stop this, to push back against this agenda, which is really tyranny and control of the masses by the very few, the elite. So that's the first tour. Should I tell you about number 2?
Yeah, that first tour is Alberta and British Columbia.
Yeah, so we're going to start off in Edmonton. I think we're starting on the 26th of September, and we'll be traveling for about 12 days, catching all the northern parts of BC and Grand Prairie as well. And then that's part 1, and we'll see how that goes to do a 2 and a 3, and we'll try to launch it across Canada. The other thing we're doing is we're going to have there's a fantastic film which was produced by the filmmaker is Todd Michael Harris, Canadian filmmaker, and he's made a film called Uninformed Consent. And it's a great film because it's one that you can show. You can show your friends or your family and say, look, just sit down and watch this, and then we won't talk about it anymore, because it's designed for those people who have figured out that there's something wrong. They've found a few dots, but they don't know how to connect them. Like, how did this happen? Why did it happen? Why is it happening in lockstep around the world? And that film, Uninformed Consent, we're going to be showing at theaters in Ontario. It is available on the internet at uninformedconsent.ca.
Okay.
But we're going to show it in theaters and have some fun and meet people and maybe have some cocktails. So we're on October the 8th. It's going to be in Toronto, and then we'll have some more information coming out about the other locations.
So September 26th, kick it off in Edmonton, and then October 8th, you're going to be in Toronto with a film. And I think people would be well advised to attend if they could. I think as a minimum, if for the vaccinated, I would think they maybe want to get a D-dimer test and see if they're actually dealing.
I would say so, yeah. I would say that. So they need to know also what kind of test to request from their doctor. The trouble is that a lot of people are afraid to go to their doctor because the doctors have been captured mentally as well as prescription wise, and they're afraid that they're going to be fired by their doctor. Their doctor's either going to fire them because they're contradicting what the doctor says. And some doctors say we hate Dr. Google. But really, if you're inquisitive, you're gonna like any information that a patient brings to you. You may quickly scan it and say, I don't think that's accurate. But often I've had it where patients actually kind of tell you the diagnosis, right? So you should listen. And but people are afraid to go to the doctor, that they might be fired, or they might be given an anxiety medicine, or sent to a psychiatrist, or that type of thing.
Yes.
And so they're afraid. So what do they do if they can't go to a doctor? And many, we have I think I don't know how many is now, like 1 million people in BC who don't have a family doctor.
Yes.
And and when you go to the walk-in clinics, if you don't get there like the night before and camp out, you won't get seen.
Isn't it odd that we started this whole thing off, and when it kicked off, flatten the curve, couple of weeks, just to allow the medical system to spin up. Quite frankly, I was okay with that. That sounds like a cautious way to go, a good way to go to and see what we're dealing with. But it's turned out we're almost 3 years into this, and we've collapsed the medical system across the country. The system basically is collapsed.
Yeah, and there's two ways of looking at it. One is, that it's not going to be good for people, and they can't find doctors. Those that are looking for transplants are being refused because they're unvaxxed. Some really atrocities are going on in the doctor's office. I'm not saying there aren't good doctors out there, and some doctors are quietly telling their patients, don't get the shot; it's harmful to you, and but aren't standing on a public stage. But the other one is destroying the infrastructure is part of the Great Reset, right? To build back better, you got to destroy first. And so it's almost as though you're kind of winning by destroying the system. And recognizing that, some of us, like at the Canada Health Alliance, which is a network of healthcare practitioners across the country, we have 5,000 members. We're trying to envision and to help create the new medical system. And we're starting to do it now because we want it to grow while the other one's coming down, so that people aren't left in the lurch. And so Canada Health Alliance,
that sounds like a great initiative, because there has to be some sort of a reckoning with the health system that basically did this to us, and in the process took away all of our civil liberties. We're talking now about having no civil liberties just so we can have a medical health system that doesn't even talk to us.
Absolutely, crazy. I know. And our health system is a little bit. I'm not for electric cars because the issues that it's kind of a bit of a con job, right? And that you can turn someone's electric car off from a distance, and if we're not going to have any electrical power, you're going to tell you keep your car in the garage for the next 3 weeks, and otherwise your carbon footprint will be too big, whatever, the story. But it's very similar in medicine in that we have not examined all the types of integrative therapies that are out there, like orthomolecular medicine, nutrition in general, acupuncture, homeopathy, functional medicine. There's just so many out there that have been ignored or sidelined. And we also need to look at the vaccination issue in general as well, because And maybe people will start doing that when they start to see how the pharmaceutical companies con them the COVID shot.
Well, I'd like to see them start with the funding paradigm. It looks like Public Health Canada is now funded to the tune of, I think, 95% by big pharma. So the big pharmaceutical industries are actually funding our public health services. So that seems like a little bit of a conflict of interest to me. Huh.
It is. Well, Health Canada, they just rubber stamp stuff, and the people that pay Health Canada now are the pharmaceutical companies that are trying to pass their drug through them. So it's a bit like, would you bite the hand that feeds you? Not likely, right? Oh. And although they say they're doing independent research, they look at all the stuff carefully. That's a bunch of baloney. They just rubber stamp what comes out of the United States, and they don't even look at it. So. All those groups, CDC, FDA, Health Canada, they're all completely captured by the pharmaceutical industry and by, all the, I guess we call them the elite, though I would say they're not really the elite. I don't know if you can call, parasites the elite, really.
No, maybe they're just parasites. I don't know.
They are. I mean, they're living off us. I mean, it's obvious. Where are our tax dollars going? They're just being squandered.
They're not going to my to make it easy for me to find a doctor. They're not doing that, I'll tell you, with our tax dollars.
No, they're
Now, where
not.
can people get a hold of you or take a look at your stuff? Do you have a website, Stephen, that people can apprise themselves on?
Sure. Well, I don't have a personal website, but the CanadaHealthAlliance.org. So it's not Canadian, it's CanadaHealthAlliance.org. That's a good place to go because I'm the president of that association, and we work hand in hand with many of the organizations for health around the world, including the World Doctors Alliance and the COVID, the Canadian COVID Care Alliance, and also the Doctors for COVID Ethics, which those are international. So that's a place people can. Also, we have an excellent library there. People can go and look up stuff, and a video library and materials easy to go through. And we have videos of the week, so it's actually a very good resource for people. I mean, if you want to send us a letter, there it'll come to me if you have comments or suggestions. And but that's a good place to start.
Excellent. Well, that's thanks for coming forward, Stephen, and providing this service to Canadians. I mean, it is so direly required. We're just not getting any information, and people like yourself who are standing up at a great cost to do this for us. I think, well, I know that down the road you're going to be recognized the way you should for it. So thanks again, Stephen, and please let's keep in touch.
Okay, thanks, Russ. Thanks for having me on.
Okay, you're welcome.